It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Why does a dog have a lot of gas? The formation of gas in the stomach or intestine is called flatulence. Nowadays, most people refer to the annoying and quite offensive smell and noise associated with flatulence as fart or gas. Let's face it, nobody likes to share an environment with a pet that suffers from flatulence. We will talk about why your pet has flatulence and what you can do. 1. What causes flatulence in dogs? It is normal for gas to be produced and for it to build up in the gastrointestinal tract. However, in some situations this gas production increases and can become excessive. The most common cause of excessive flatulence is a change in diet or the dog ingesting something new or spoiled. Most cases of chronic flatulence are caused by a diet that is poorly digested by the dog. These poorly digestible diets cause excessive fermentation in the colon and subsequent gas formation. Soy, peas, legumes, dairy products, high-fat diets, and spicy foods are often associated with flatulence in dogs. Dogs and cats are lactose intolerant and, if fed milk or dairy products, often suffer from flatulence and gastrointestinal upset. A dog that is fed a premium diet and continues to suffer from flatulence should be tested for malabsorption, i.e., poor digestion or malabsorption of dietary nutrients. Dogs that swallow air, especially those that eat rapidly, are more likely to suffer from flatulence. Overweight, obese, and sedentary dogs are at higher risk for developing chronic flatulence, regardless of diet. 2. What are the clinical signs of flatulence? Common clinical signs include passing gas from the anus, with or without odor, mild abdominal discomfort, mild stomach distension or bloating, excessive gassing or rumbling from the abdomen. If a dog has an underlying malabsorption problem, clinical signs may also include loose stools or diarrhea, vomiting, and weight loss. 3. How is flatulence diagnosed? Diagnosis is based on the history and clinical signs. Some of the most common causes are aerophagia, increased swallowing of air, nervous eaters, gluttony or compulsive eating, respiratory disease, feeding shortly after exercise, brachycephalic or flat-faced breeds. Diets high in soy, peas, or beans. Diets high in fermentable fibers such as lactulose or oat bran. Milk and dairy products. Sudden change in diet. Spicy foods and food additives. Spoiled food. Diseases. Inflammatory bowel disease. Small intestinal bacterial overgrowth. Tumors. Irritable bowel syndrome. Intestinal parasites. Enteritis. Exocrine pancreatic insufficiency. Other tests that may be required to determine the cause of excessive flatulence include fecal examination and evaluation, rectal cytology, fecal cultures, blood and urine tests, serum cobalamin and folate tests, abdominal X-rays, abdominal ultrasound, and intestinal biopsies. 4. How is flatulence treated? Treatment is based on the diagnosis and usually involves a change in diet. Dietary recommendations include a diet that is highly digestible and low in fiber and fat. In some cases, prescription diets and medications may also be necessary. 5. Is it really possible to fix a flatulence problem? Most patients with uncomplicated cases respond well to dietary and lifestyle changes. Once the problematic dietary substances have been identified, it is important for your pet to avoid them to prevent further problems and medical complications. If you have tried adjusting your pet's diet and there has been no change in the amount of flatulence problems your dog has, contact your veterinarian to identify the problem. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.